Dear colleagues, namaste, and we keep 1 meter of distance, social distancing. This is a video strictly for doctors and medical institutions who are confronting coronavirus infected patients. So my aim is, I'm Dr. Nishan Mohipat. I am a plastic surgeon, basically from Mauritius. Right now I'm in Mumbai. The situation in the world is alarming. We have more than 27,000 deaths, 600,000 infected cases worldwide. My aim is to make you understand that we have to learn from the situations from countries, what has happened to China and France and Italy. What's happening is the positive cases, which are 80% we consider as mild to moderate, they are being treated, especially the mild cases, treating as outpatients. But what happens here? And 6% of the cases are critical. But here I'm going to talk about the mild cases. There is no drugs FDA approved for the treatment of coronavirus. Which is what we're facing is SARS-CoV-2. But what we can face is we confront the pathogenesis, the immunopathology, the clinical picture of based on the immunopathology. So we all know it has an incubation period of 2 to 14 days. It affects the mucosal cells. It hijacks the immune system. It penetrates in the cell. The virus, the coronavirus, it has the spikes. The spikes, they have certain kinds of protein that bind with some receptors of your cell membranes and penetrate inside our cell, uses the Golgi apparatus, the nucleus of our cell, for replication. So we normally don't treat influenza. Basically, we are considering it like an outpatient is influenza patient. But what next? That's why we are kind of restricted. But I'm just suggesting for certain treatments that can be considered, and it's just a medical suggestion. I highly condemn self-medication. This is a strictly reserved video for medical practitioners. So the lung cells, what happens? It attacks the lung cells of the respiratory tract and attacking the cilia. Then the cell of the epithelium are damaged and they come out of the epithelia, and then they become an obstruction of the respiratory tract. It attacks the mouth, the nose, the taste bud, we have anosmia, the smell sense goes. This is very important because we lose appetite. The immune system is impaired here, and it's a complex immunopathology that happens. It attacks the throat. When it goes down, the bronchi, if it reaches the alveoli, there when it destroys the cells, then it is alarming, because what happens, there is fluid accumulation, and then we have lobar pneumonia or bronchopneumonia. So treating the 80% of the mild patients, most of the countries will reach that they will have to treat these patients as OP patients. But we don't treat influenza. So we just consider it, we should not be considering it just paracetamol. There are many things that we have to tackle. And I've been guiding patients and I've seen results. First, we have the paracetamol. We know the doses, we all doctors. Second thing, which is very important, is ascorbic acid, vitamin C. It can be on simple basis, it can be given orally or it can be given intravenous. The dose is high dose 1 gram per day or intravenous 1.5 per day, and it has been proven in China. Patients infected have shown results. What is the mechanism of action? It helps in apoptosis, clearance of spent neutrophils by macrophages, thus decreases necrosis and potential tissue damage, which then, if there is the tissue damage of the lungs, what happens is when the T cells, the killer T cells, I'll come a little bit, or let me explain you right now a little bit of the immunology. When it kills the cells, the targeted cells, so not only the good cells are being targeted, even a good part of the tissue, lung tissue, and this causes more complications, respiratory complications. So the cell is infected by the virus, then the host doesn't know, we don't know, our body doesn't know. What the cell has an intelligence. Part of the protein of the virus is to be taken by the cell and presented as MHC, major histocompatibility complex. And then this triggers the T cell, which come as a killer cell to attack this cell. And there is one more thing very important to understand. There is a cytokines, it's a protein secreted by the T cells, which brings signals to the cell, from the T cell to the infected cells and also the neighboring cells. So there is a cytokines in storm during COVID-19 infection. This is what we have to understand very well. So there is also infected cell that causes humoral immunity and cell-mediated immunoreactions. So in humoral, we have IgA, which is mostly secreted by the mucosal part. Then we have the cell-mediated T cell, natural killer cells. Sometimes the virus become more. They control the cell to reduce the number of MHC. Then the natural killer cell detect these cells, and there is communication between the cells. So we have to understand to that level. It's not only simple influenza. So now we started with the vitamin C. I told you it enhance proliferation and differentiation of B and T cells, protect cells against reactive oxygen generated during respiratory bursts and inflammation. And I'll go to the next medication. These are safe medications that doctors can easily prescribe. These are all suggestions to be interpreted by doctors. You can complement with zinc. I'll explain you the importance of zinc and the dosage and all that. So it inhibits, vitamin C inhibits apoptosis of T lymphocytes. Here there should be a balance. Only the viral cells, infected cells should be damaged and not the healthy cells. So it's a fight in the body and we have to maintain the balance, which is difficult. Now here comes another medication which is very important, is zinc. Normally zinc gluconate, a minimum of 30 milligram per day, more advisable to be taken at night. So the mechanism of action, 10% of human protein bind zinc. Immune function for wound healing, catalytic cofactor protein. Taste and smell, it will enhance the taste and smell. The patient which is normally affected, which cannot eat, if the immune system, the patient is affected, the appetite is gone because of his sense of smell and taste, so the patient won't eat and goes weak and weaker. So we have to take the mild cases and maintain them and boost them so that they get out, they don't become worse and worse. So zinc increases resistance to epithelial apoptosis. It protects the respiratory tract. It induces production of antibodies and lymphocytes. So here it's not like nutritional supplements. They are intervening and in the pathogenesis in the immunopathology, which is very important to note. Another medication. So we start PCM, basically vitamin C, zinc. Another medication which is accepted in Europe also, it's Septilin, basically from Ayurveda. It's a polyherbal medications. It helps in different arms of the immune system. It helps in URTI. It strengthens immunity. And normally 2 tablets BD. This is the dosage, but you can research about it and consider, because these are safe drugs that we can play safe with. And one more important aspect is the spikes of the coronavirus. The spikes, they are the proteins that bind to the receptor cells, and the way they bind is they are type 1 glycoprotein. It's a kind of similar like influenza and HIV. That's why drugs against influenza, antiviral drugs against influenza and HIV drugs have shown to be effective. But here my point is how to treat the mild case in a very moderate, the simplest way, the safest way as OP patients. Now we have vitamin C, zinc and Septilin all over. Basically PCM, paracetamol, vitamin C and zinc are very important. Now we go to a very cost-effective, safe antiviral, which is called Tamiflu or Fluvir in India. It's a very optimum, the cost is optimum. It's even patients with renal impairment can use it. So what it does, it prevents the virus to cause replication. You know, the virus goes in the cell, they replicate themselves, the RNA and all that. Like they have the transcriptase complex process that happens. They can replicate in thousands of themselves. So replication is blocked by neuraminidase inhibitors. So this is a very optimum treatment that I can only suggest for doctors to consider. And the dosage is 75 milligram tablets twice per day, BD, for 5 days. And it can be administered for kids also, for infants since 1 year. The dose 1 to 3 is 30 milligram, 3 to 6 is 45 BD, all of BD, twice daily. 6 to 12 is 60 milligram BD. So it's important to know China has done a study with combined with HIV antiretroviral ritonavir, but there are complex drugs, expensive and not so practical to use. So oseltamivir, Tamiflu, is quite I would suggest is quite is reasonable to be used. Now we come to a big the big controversy. What has happened? People heard about the anti-malarial drugs, aminoquinolones group called chloroquine or hydroxychloroquine. Note that hydroxychloroquine has lesser side effects, retinopathy especially. The mechanism of action will tell you why it is being it has been banned, like in France. What has happened, why we had death of patients, and especially self-medication, listening to media and all that. That's why I'm saying I'm totally against self-medication. All these informations are strictly for doctors. So the first thing I'll tell you, it inhibits production of cytokine. So what happens when the virus has attacked you? There is a cytokine storm, but there needs to have apoptosis of the virus infected cells. When it reduces cytokine, so your body has a high number of virus infected cells and there is no defense. It has cut the defense, the catalyst, the messenger. Cytokines are the messenger that brings the signals from the T killer cells to the infected cells. So this is what it does, and at early onset, especially certain parts of the world, if they are still using it, you have to be scared. At the early onset, it is dangerous, and it has even shown to be fatal. This is the point. So what it does else is modulate lysosomal activity. It interferes with autophagy. So especially at the beginning of the disease, it's going to be very, very dangerous. And the normal dose is an average dose of 400 milligrams per day. So you have seen an overview. I repeat: paracetamol, vitamin C, zinc, Septilin, oseltamivir, Tamiflu, hydroxychloroquine is a little bit scary to be used. So this is a package of drugs that can be easily used with less side effects, but strictly to be monitored by doctors. And now, where we go to drugs, more advanced cases which are that requires hospitalization also, that goes with major cares like artificial ventilation and ICU cares and all that. But one thing you have to know, for example, interferons, they prevent replication of virus that are part of the humoral part of cell mediated. There is humoral and cell mediated. So interferons, for example, interferons or IgA, they all have been used. They have been used in China. They have tested, but it's not on a practical basis. It has a lot of risk. So that's why I'm telling you the package that I'm suggesting is just a debate. It is not an indication. It is information for doctors to understand that most countries of the world, we will have to follow what France, what Italy, what Spain are facing. We'll have to make selection, a proper triage to treat the patient OP with home quarantine and with a package of drugs that they're effective. Like, you have to be careful. It's not zinc just as a supplement. Here it is minimum 30 milligram that you have 30. You have the tablets can be 15 milligrams or 50 so minimum 30, 2 tablets of 15 has to be used. So, and vitamin C, if you can, it's oral, it's easier per oral, or if it is IV facility, so it is up till 1.5 grams. And very important point to note about vitamin C is it protects against the tissue damage, the potential tissue damage that can happen from the killer cells. So it is like a, it is there should be a balance. That's why there is a danger from a big hazard with chloroquine. So dear doctors, dear colleagues, I hope this information will be useful, and I wish that the information can be also implemented. That's my point. We are in a critical situation, and I made the point in such a way, the points in such a way that they can be implemented. So we have to think it is like an influenza, only a part of it, but it is something that really attacks our immune system. And that's why what happens when the people with immunosuppression, when the virus, they attack the cells of the alveoli part, then we have it goes up to respiratory failure and MSOF in critical cases, and finally fatal. So we have to handle most of the cases that are mild in such a way that we keep them mild till cured. That's my motto, and I hope it will be helpful to all the colleagues, all in different parts of the world, and most of the information to be easily implemented with due consideration and your own research. Thank you very much, and God save the world. Thank you.